In today's session, we are going to cover poultry diseases and veterinary medicine. If you want to have a successful poultry enterprise, it's very essential to understand that diseases must be kept at bay. How do we keep diseases at bay? It normally starts with the environment in which we rear the birds. Operate in an environment that is always clean, an environment that is always dry, an environment that doesn't have stagnant water. Once you are able to achieve that, 80 to 90% of your problems are solved. Additionally, there are certain remedies that you can buy from the shop that can assist you to keep your birds in good health at all times. I'll start off with these 3 bottles that are here. This group of remedies, they are what we call vaccines. Vaccines are remedies that we use to prevent a disease from occurring in livestock or in poultry. The idea is you introduce a similar amount of the disease-causing organism into the bloodstream of that specific poultry bird, and then the natural immunity of that bird starts to produce antibodies that must keep the disease at bay. So we have 3 types of diseases that are always common in poultry farming. The first disease is Newcastle disease. It's a notifiable disease which is highly contagious, and farmers can always prevent it by using a vaccine called ND-Clone 30. ND-Clone 30 is a vaccine that is water soluble. If you were to use this vaccine in your poultry enterprise, you will notice that there are small capsules that are contained in here. You dissolve these capsules in 5 liters of water, then you give that amount of mixture to your birds as a drinking remedy. Or alternatively, what you can do to be more effective, as you can notice on the label, it says you can cover 1,000 birds per vaccine session. So you have to put the remedy of this with water in 5 liters, you pour it in a knapsack sprayer, and then you spray the chickens specifically on the heads. Apart from ND-Clone 30, we also have another disease which is known as infectious bronchitis. Infectious bronchitis is one of the diseases that affects the respiratory system of the chickens. You will notice some of the signs include reduction in egg production, or if your layers are producing eggs, they will produce eggs that have a thin shell and they can easily break. And also, when the chickens are trying to breathe in and out, there is always a rough sound that is produced. Then you can already know that there is too much dust accumulation in your house. That's why the respiratory system of the chicken is affected. When we have IBMA5, it works the same way as ND-Clone 30. You take these capsules, you dissolve them in 5 liters of water, then you give that specific mixture to your chickens to drink, or alternatively, you can put the mixture in a 5-liter knapsack sprayer, then you spray on the head of the chickens for the remedy to go through the eyes, and that is one way to do it. The other common disease is infectious basal disease, which is known as Gumboro disease. The vaccine that prevents that disease is Gumboro D78. It's the same as these other 2. It's capsules that you dissolve in 5 liters of water. You administer it through drinking, or you administer it by spraying the remedy on the head of the chickens. These 3 remedies usually only work when the chickens are healthy. You vaccinate when your chickens are not showing any signs of diseases. If now you have seen signs of diseases in your flock, it's time to switch from vaccines to antibiotics. An antibiotic is any remedy that is administered to an animal to treat a certain disease. With me today, I have Doximax 50%. This is an antibiotic that focuses on treatment of bacterial respiratory diseases and gastrointestinal infections in foals, so in birds. So this one is a specific remedy for broilers. When you open the pack, it will give you the instructions, and usually it comes with a scoop. This is the scoop that measures 5 milliliter. You fill it up with the powder from this sachet, and then you put in 4 liters of water. Then you give this remedy to about 12 to 20 chickens. So when the chickens that are affected drink this specific remedy, when it's now available in water, you are now trying to treat that specific problem. And remember, when you use these remedies, it's very essential to know that there is always a withdrawal period. If I use Doximax 50% to treat I can only slaughter my broiler birds after 9 days and consume. So I must not slaughter to consume within 9 days after administration. For layers, this is not recommended. You can use swadoximycin, which covers layers, and dual purpose chickens. If I'm using the vaccines, most of the time they work like the cattle sheep vaccines. After administering these vaccines, the withdrawal period should always be 14 days. And as a concluding tip, always remember, if you want to be effective in how you use the remedies, withdraw water from the coops of your chickens for a period of 4 hours to ensure that if you mix the vaccine or the antibiotic in water, the chickens should be in a position where they are thirsty and they will rush to the drinking containers to get access to water. So when they are drinking the water, it easily helps you to vaccinate your chickens effectively, and it also helps you to treat your chickens effectively. So thank you so much.